One of the least talked about issues affecting men, mental health. 1 in every 5 men in Canada will face a mental health challenge this year, and many will shy away from seeking the support they need. In fact, evidence suggests that women are almost 3 times more likely to seek help. So why do men find it so hard to talk about mental health issues? Is it embarrassment?
I mean, again, I want to expand the conversation because one is about, creating spaces for men. The second thing, I'm part of the College of Registered Psychotherapists of Ontario. We have the data. In Ontario, 80% of the registered psychotherapists are women, and there's only 20% that are men. And so imagine it was the inverse, that 80% of the therapists were men. I think there'd be a subset of women that maybe find it difficult to go speak to a male therapist. And so I think that's part of the discussion as well in terms of, we need to get more male therapists and promote this profession so that that subset of men that maybe don't feel comfortable going to a woman, and the gender of a woman has no difference about the efficacy of therapy, but just about the fact that some men might not feel comfortable going and speak to a woman, and we just don't have a lot of male therapists available.
But would they be more comfortable going to a man? I mean, I don't mean to oversimplify this, but men don't like to ask for directions, let alone speak about their health. There's something to that, I think, Dr. Elterman.
I think there is. I mean, I think there's a lot of peer support programs that have been very effective. When I worked in New York a while ago, and one of the initiatives that they had in the African-American community was to bring blood pressure monitoring into barbershops. So they thought, what is the most common place where men are going to go and feel comfortable and talk amongst themselves? And they had a mobile team from the hospital go in there just to check their blood pressure while they're getting their hair checked. So I just think like the idea of creating, as you said, spaces where men can come in, where they feel more perhaps comfortable, and also reaching out. Maybe there's an opportunity to engage with professional sports teams and other places where men are frequenting to see if we can get their health sort of integrated into the other activities that they're participating in.
When you look at some of the numbers, the self-destruction associated with excessive drinking and drug abuse does tend to be more prevalent among men. Why do you think that might be?
There's a challenge that men face, which is that the machismo, the bravado piece that comes in as we grow up and go through teenage and even young adult years puts us into situations where drug abuse, alcohol, smoking are rites of passage. They are purported to make you more of a man. At a stage of your life when you don't really understand how bad those things really are. And then down the line, when you develop the maturity, men seem to mature much later than women, that's the truth, right? When you develop the maturity, you realize that was probably a pretty terrible idea. But by that time, you've exposed your body to these types of challenges already, perhaps in the setting of addiction, in the setting of the consequences of addiction, which can include, poor mood and worsening mental health. And by that time, you're stuck in a cycle where it's even harder to get out than it would have been early on.
What about loneliness? Are men primed for it? How do you break through this insidious social disease?
This is really difficult. I mean, I think it affects women and men. And for men, we see it a lot in the office. And it's a really difficult thing to treat because it's really about, having them reach out, which is something historically they haven't been really comfortable doing. It's really difficult and it's very pervasive. And it's ultimately at the heart of most of the addictive behaviors that we see, right? That pain is so intense, and then the only way they know to do it is just to medicate it. So it is really difficult. And again, the idea of creating spaces is just something that maybe we can make a movement to. We at our clinic, we have a men's group that's really popular. It gets booked up 3 months in advance. And just watching these men just finally open up with other men and really kind of, connect is something that they don't see.
And it can be a vicious cycle because one bad behavior can lead to another, As far as depression, does it manifest itself differently in men than in women?
Yeah, the screening that we use for depression is identical between genders. So the symptoms of depression are identical. It's then what they do to handle the depression. So the men's response to the depression is primarily drugs, addiction. I mean, right now we see a big rise with gambling. That's a big thing that's really spiked up. Pornography, sex, drinking. That's really kind of ultimately at the heart when we're working through an addiction. we're going to start to find some of the isolation, some of the loneliness, some of the depression, and at the end, a lot of childhood trauma, which is really incredibly pervasive among men, but often not spoken about. And sometimes in our practice, we'll hear things like a client will tell me that, he was 14 years old and he got lucky. He had sex with a 24-year-old woman. And for him, he never saw that as a form of sexual abuse. He thought, hey, I got lucky. And it's just interesting to see sometimes the childhood trauma is not even recognized.
The show is designed with men in mind, but women and partners are equally as important. What do you say to women and to partners insofar as how they can support their loved one?
I think one of the challenges is that there's the term that gets used, and we see that in the relationships, and I will say in a heterosexual relationship, is that man up, right? And sometimes it's implicit, right? And just to move away from that idea that if you see your partner maybe, not taking initiative, not showing up the way you want your partner to show up, there might be something else going on there. And maybe that's a different type of heart-to-heart rather than, hey, why don't you man up and do this or do that?
All right, really good information. We're keeping the spotlight on men's health issues right after the break. Don't go away.